Good day, everyone. My name is Tanekia Mullings, and today I will be presenting Unit 17, Human Immunity. This presentation has three sections with details listed on the screen. Infectious diseases are illnesses triggered by harmful pathogen that enters the body from outside. Pathogens that cause contagious diseases are viruses, bacteria, fungi, and parasites. A virus is an infectious microbe with a nucleic acid segment. Viruses cannot replicate alone. Instead, they must infect cells and use host cell components to make a copy of themselves. Bacteria are microscopic, unicellular organisms and independently reproducing and most free living and can cause food poisoning, urinary tract infection, and tuberculosis. Fungi are a diverse group of eukaryotic cells that survive by decomposing and absorbing the organic material in which they grow. Fungi are responsible for causing conditions such as yeast infection and meningitis. A parasite is an organism that resides in or on the host and gets its food at the host's expense. Example, malaria and scabies. An infection can cause fever or other health problem depending on where in the body it is. It can be spread through direct or indirect contact. Indirect contact or food contamination and insect bites. Contact arises from reservoir to contaminated surfaces, objects, or vectors. Example, mosquitoes, flies, and mites. Indirect infection spread once a sick individual coughs or sneezes, sending infectious droplets into the air. Once a healthy person inhales the contagious droplets, or if it lands directly in their eyes, mouth, or nose, they risk becoming ill. While direct contact is person to person and animal to person. Direct infection spread when disease causes microorganism which passes from an infected person to a healthy individual through direct physical contact with body fluids or blood. Example, touching, sexual contact, contact with oral secretion, or contact with body liaison. The human body has three lines of defenses, including physical and chemical barriers, nonspecific innate responses, and specific adaptive responses. Innate or nonspecific immunity is the defense in which human beings are born with, and it protects them from all antigens. Innate immunity is the barrier that keeps harmful materials from entering the body. It forms the immune response's first line of defense. Example, enzyme in the tears and skin oils, cough reflex mucus, which traps bacteria and small particles, and the skin and stomach acid. The skin is a human's largest organ, and it's a barrier between pathogen and microorganism that have to make it past the first line of defense. If the shield breaks, activation of the body's second line of defense begins, and the skin forms a waterproof mechanical barrier preventing the penetration of microbial organisms, chemical irritants, and toxins. The dermis and the epidermis layer of the skin plays a vital role in scar formation and biological processes in repairing wounds. Whenever a wound penetrates the dermis, the skin repair response begins. Any damage to the dermis signals fibroblast skin cells to synthesize massive amount of collagen sent to the wound site, promoting growth factor and rebuilding new skin tissues. At the same time, the epidermis flaunts the new skin tissue as a scar, which appears discolored and raised. The body continuously defends against microorganisms using enzymes in the secretion of internal mucous membranes. It filters infectious agents, pathogens, and allergens while allowing nutrients to pass through. Stomach acid, pancreatic enzyme, bile, and intestinal secretion are found in the gastrointestinal tract, which provides a chemical barrier against infection. Chyme move through the digestive system via peristaltic contractions and remove microorganisms that may cause harm. It's believed that 70% of the immune system is located in the gastrointestinal tract, where diverse bacteria are. This indicates the importance of maintaining a healthy gut. Pathogens enters the body through the mouth, eyes, nose, or urogenital openings, or through wounds or bite that may breach the skin barrier. The nose is filled with microscopic hairs called cilia, which help push mucus and other debris away from the lungs. These hairs act as filters, preventing dust, pollen, and allergen from entering the lungs. When particles enter the nose, they get stuck on a thin layer of mucus, then eventually get sneezed or swallowed. The urinary system filters blood, remove toxin and waste from the body through urine, and eliminate excess water, salt, toxin, and other waste products. It uses a series of tubes connected to the blood vessel, digestive system, and ducts to pass waste. This includes a kidney, ureters, bladder, and urethra. Women have a shorter urethra than men, meaning bacteria are likely to reach the bladder or kidney faster, causing infection. However, bacteria that enter the urinary tract are washed out when the bladder empties. An inflammatory response is a second line of defense. It begins when a pathogen increases blood flow to the infected area. Blood vessel expand while white blood cell leaks, invading the contaminated tissue. These white blood cells are called phagocytes, engulf and destroy bacteria. The area becomes red, swollen, and painful during an inflammatory response. This is crucial as it sees damage from spreading while healing. When the phagosome fuses with lysosome, it creates a phagolysosome filled with digestive enzyme that destroy the content and ends phagocytosis. The macrophages develop from monocytes when inflammation occurs and are vital to the immune system. They are a variation of cytokines cells which protects the body from microbial infection by blocking and destroying pathogens. Cytokines are small and membrane-bound protein-based cell signaling molecules that aid cell-to-cell interaction in immune responses and encourage movement of cell towards site of inflammation, trauma, and infection. Proteins are activated when triggered by pathogens present. They interact by creating a flow of reaction, attracting phagocytes, removing unwanted particles, initiating inflammation, and producing proteins to attack the invading organism. An antigen is a molecule stimulating an immune reaction by triggering leukocytes that combat diseases. Antigen may be present in invaders, example, bacteria, parasite, viruses, fungi, transplanted organ, or abnormal cell, example, cancer cell. Studies show that antigen presentation are absent in resting neutrophils, but macrophages can produce and present antigens. The list of white blood cells shown on the screen helps protect the body against infection. Neutrophils are white blood cells essential to the immune system that help the body to fight against infection. They also help protect the body from infections by killing bacteria, fungi, and foreign debris. Lymphocytes consist of T, natural killer, and B cells to protect against viral infection and create protein to help fight infection. As you can see, there are a list of other cells and definitions showing on your screen. Immunoglobulins are glycoproteins molecule produced by plasma or white blood cells. They act as a crucial part of the immune response. They identify and bind to specific antigens, example, bacteria or virus, and aid in destruction. The five primary classes are listed on the screen. The immune system can distinguish between body cell, self, and foreign material, non-self. All nucleated cells of the body possess specific surface molecules identifying them as self. These self-makers are key histocompatibility complex molecules, MHC class 1, and operate as identification tags. The immune system won't react to the cell bearing these genetically determined markers, self-tolerance. Any substance recognized as foreign and capable of generating an immune response is called an antigen, non-self. B cells will produce antibodies if antigens enter the body, and B cell remembered it either from having had the disease prior or being vaccinated against it. When antibodies attach to antigen, other parts of the immune system attack and destroy the invaders. Sensitivity is the exaggerated immune responses that protects the body from foreign bodies known as antigens. When the immune system identifies antigen, the hyperimmune reply begins and the hypersensitivity reaction starts. As you can see, the image indicates the onset time of responses for each and what they entail. Autoimmune disease happens when the body's natural defense system cannot distinguish between your own and foreign cells, causing the body to attack normal cells mistakenly. A few common types of autoimmune diseases are listed on the screen. Type 1 diabetes is a chronic lifelong disease that prevents the pancreas from making insulin, an important hormone regulating blood glucose. Individuals with type 1 diabetes need synthetic insulin daily to live and be healthy. Some symptoms include excessive thirst and hunger, fatigue, blurred vision, baffling weight loss, frequent urination and food diapers in infants, slow cut healing, and yeast infection in females. Rheumatoid arthritis is an ongoing chronic disease in the joints on either side of the body, with symptoms of pain and inflammation in the fingers, hands, wrists, knees, ankles, feet, and toes. Uncontrolled inflammation damages cartilage, acting as a shock absorber in the joint, causing joint deformity. Eventually, the bone erodes, leading to the fusion of the joints. This genetic disease is 2.5 times more common in females at birth than male and is present in smokers. Organ transplantation replaces dysfunctional tissue with healthy tissue from either a living or recently deceased donor. When the organ donor is not the recipient or genetically identical twin, the immune response to the new organ becomes extremely important to prognosis. The grafted tissue expresses antigen not present in the host, identified as foreign. The immune system reacts as the donated tissue is an infectious microbe and attacks the graft. As mentioned in the presentation earlier, the immune system recognizes antigen in the surface of cells as foreign or self. Hyperacute transplant rejection occurs immediately, as often evident while patients are in surgery. It's caused by accidental ABO blood type mismatching of donor and recipient. However, anti-CD3 monoclonal antibodies are clinically used to treat organ allograft rejection. Other transplant rejection are listed on the screen. Section 3. Adaptive immunity. Active immunity results from exposure to a disease organism which activates the immune system producing antibodies to the illness. Active immunity is required through natural or vaccine-induced immunity. Exposure to pathogens such as common cold develops natural active immunity. There are many strains of common cold. Once the body becomes exposed to either, the immune system creates antibodies that fight the virus, which is then stored in the memory B cells as immunity to that particular strain. Artificial immunity is gained through antigen introducing through vaccine, causing a reaction that stimulates the production of antibodies and memory cell. Immunological memory is if the body becomes infected with natural occurring antigen after vaccination, the body attacks and destroys them before symptoms of the disease develop. Natural passive immunity is when the antibodies are passed from person to person, example, mother to unborn child, with protection up to 6 months. Artificial acquired passive immunity is protection given to a person by injection or transfusion of antibodies made by others. These antibodies neutralize the infectious agents usually with protection lasting only a few weeks since the antibodies gradually break down and are not replaced. Vaccination is a safe, simple, and effective way to protect against harmful diseases before you come in contact with them. It uses the body's natural defense to resist specific infection and strengthen the immune system for years. Vaccine prepare the immune system to create antibodies just as when exposed to diseases. However, because vaccine contain only destroyed or weakened form of germs, example, bacteria, or viruses, they don't put you at risk of its complications. The primary immune response occurs when someone is infected with a pathogen for the first time. The lymphocytes identify the antigen and takes time for the plasma cell to produce an appropriate antibody. If the body re-encounters the same pathogen, it will react with secondary response faster than the primary. The memory cell quickly recognizes the pathogen and produces the required antibodies to fight the antigen before the occurrence of symptoms. WHO indicates that measles is a highly contagious disease caused by a virus, and before introduction of the measles vaccination in 1963, major epidemics occurred approximately every 2 to 3 years. The chart reflects the number of measles cases in the UK from 1940 to 1995 before a vaccine. In 1967, the year before vaccination was introduced, there were 460,407 suspected measles cases in the UK. 99 people died and no more than 2 people died per year from 1999 to 2017. Between 1995 and 1999, a total of 10 people died aged 10 and over. The combined MMR vaccine was introduced in the UK in 1988 at the end of the year, bringing down the figure for suspected cases a year, with 1 or 2 deaths. Also, number of children receiving MMR vaccine declined in the 2000s. Measles reappeared in the UK with confirmed 2016 cases in England and Wales, and in 2012, 1,287 cases in the first half of 2013 and reduced in 2014. Herd immunity happens when a large portion of a community becomes immune to a disease. It can be reached when enough persons recover from an illness and develop protective antibodies against future infection. Herd immunity protects vulnerable people, example, newborn babies and elderly and those who are too ill, without requiring them to come in contact with pathogen either naturally or artificially. Herd immunity is based on the idea that the more people vaccinated, the less likely the disease spread. Several problems can occur during an outbreak before the population reaches a high immunity level to achieve herd immunity. Children in the UK receive vaccination program includes 11 plus vaccination covering diseases include diphtheria, tetanus, polio, measles, mumps, rubella, and influenza administered at a particular time in the child's life. The WHO indicates that immunization prevents 2 to 3 million deaths yearly. To increase vaccine uptake over the years since vaccines were first introduced, the NHS have introduced pharmacy has included pharmacists who can administer vaccine, making it accessible for career adults and family committed individuals to get the time to attend a clinic to be vaccinated. Research stated that vaccine uptake has been low in regions with more minority ethnic group population. Speculation that barriers to vaccine uptake consist of perception of risk, lack of vaccine offer, or lack of communication from trusted providers and community leaders, context and lack of endorsement, to name a few. Thank you for watching.